do have an umbilical hernia, we're gonna try to fix it. Like you see this little outie that you have, that's your bowel content stuff from inside of your gut that are pushing through the hole and creating this thing. You've heard me talk about umbilical hernia, and umbilicus or belly button is always a big discussion. People who are getting tummy tuck, like, how's my belly button going to look like? But the reality is that a big part of this has to do with how your belly button looks now before the surgery. We use common terms which we learned in elementary school, innies or outies. What is an outie? Outie generally means that there's an umbilical hernia. Now, you may have an umbilical hernia all your life and it may have never bothered you. But if you do have the quote unquote outie type of belly button, most likely you have a little hernia. And that means that basically something is poking through where you had your umbilical cord when you were attached to your mom back in uterus. Frequently, especially in women, when they become pregnant, that hole tends to open up a little bit more, and sometimes umbilical hernia can become a little bit more prominent. In people who have this problem very severely, they probably have already seen a general surgeon. Some people may need surgeries for it before the surgery. We looked at our own series at one point, and almost 1 in 4 to 5 women had some type of umbilical hernia. Hernias are not uncommon generally when we do tummy tuck, and they're not all umbilical. But umbilical hernia is one of the more common ones that we see, and we have an opportunity to try to fix it.